Experience with a 3D system from another company, and I had to stop my surgery because I was sick. So that's the first time in my life that I had to stop one surgical procedure because of sickness, and it was because of 3D system. When I test the 2D to 3D, the monostereo, I've never had this the same feeling, and that's what we have observed also in the group of people that we were testing, is that in the 3D group they were reporting a lot of discomfort versus the monostereo system where no one reports any problem. So this is also one potential advantage. We have testing different categories of people, and obviously this system is very close to the 3D system. So it's a very important information, and we believe that for long surgeries where the comfort of a full 3D system is not optimal for the surgeon, there can be some room for the system. Advantage being that you can switch from a 2D to a 3D during your surgery. So the idea is to use the 3D information when you need important information for example, for suturing in different places, etc. And the rest of the procedure you can do it in a normal 2D. So this ability to change from one system to the other one can be much more comfortable for the surgeon. I'm a surgeon, laparoscopic surgeon for almost 30 years. So my brain is fit for 2D image. So if I'm testing a 2D or 3D system, there is no big difference. If you are asking to people with less background, who are the one who are studying with laparoscopic surgery, obviously any 3D information is good for them, for any tasks. So this is a different way of thinking about the 3D, is to look a little bit at the background of people. Personally, with my background, I may consider that for some very precise suturing in different positions, this 3D system can help me to do it properly. But in general, when I do my full procedure, there will be very few phases where I would need this sort of additional information. So again, background is a very important factor. Young, novice, or people who are studying with laparoscopy will obviously benefit from this technology. The one with a very long background maybe won't be so obvious, but probably there are some situations where they can get some advantage. Using a conventional 3D system, you have one block. You have the camera and you have the scope, one block. So if you're doing 10 surgeries per day, you have a problem, because you can do one surgery with your system and then you have to sterilize, etc. With the system, you can plug on any other scope. So using a 10, or 8, a 5, a 3, you can plug the system, and you can plug several systems successively, which is one of this advantage. The second point is that, as you know, when we are using angulated cameras, when we have a 3D system, as soon as we're trying to use the angle, the horizon is following the twisting of the scope, and you have no horizons anymore. With the system, you can use a conventional 3D system and have the horizons all the time. So this is something that is quite interesting. A full 3D camera is very costly. If you can use it 2 times per day because you need to wash it and sterilize, and there's no clear advantage. If on the other hand you have a system that you can use during all your day, I mean basically in terms of cost effectiveness it's quite clear. So this is another potential advantage.